Serving as the invitation chair for those early fundraising luncheons in Dallas was really the easiest job you can imagine. All I had to do was ask some friends over for lunch, and we addressed the invitations to the already sold out luncheon, because Nancy is a really wonderful persuader, and so she always had sold the luncheon out before we even mailed the invitations. So thank you all very much. I'm very happy to be here today for this Global Cancer Summit. But before I get started, I thought you might want a report on some of my family members. You'll be happy to hear that my father-in-law, President George H.W. Bush, is home from the hospital, and he's doing very well. In fact, we got the word that he's already been out to dinner in Houston, so I think he is back in good shape. President Bush and my mother-in-law, Barbara, are showing George and me the way to age with grace. Last summer in Maine, Bar walked her dogs on the beach twice a day, every day. From both of them, George and I have learned that all you know you have is right now. So take advantage of your life as it is and walk on the beach every chance you get. George and I are happy that our girls are doing well. Jenna and Henry Hager are happily married, and as many of you may know, and Nancy just announced, they're expecting our first grandchild, and we're thrilled, of course. Jenna's working as a contributing correspondent for NBC's Today Show. George says she's just continuing the Bush family tradition of warm relations with the media. Too bad that has to be a joke. Our daughter Barbara has joined many of you in the health field. She's founded a nonprofit called Global Health Corps that places recent college graduates in the health field in underserved areas. Her third group of Global Health Corps fellows is at work in the United States in 3 cities and in 5 countries in Africa: Rwanda, Uganda, Zambia, Malawi, and Burundi. You can learn more about Global Health Corps if you're interested, or if you know a young person who might be interested in serving as a fellow, by looking at the web at ghcorps.org. George and I are proud of the work our girls are doing, and we're happy to be back home in Texas, where we're busy planning the grand opening of the Bush Library and Institute that will be this April in Dallas. The programming of the Bush Institute has already begun, and our global health initiative is the Pink Ribbon, Red Ribbon. And joining us today is the Executive Director, Dr. Doyen Olawole. She's the director of the Pink Ribbon, Red Ribbon. Here's Doyen. Advocating for women's health has long been important to me. I know that lifelong good health begins with awareness. And by educating women who are too busy taking care of their children, taking care of their jobs, and taking care of everyone else to take care of themselves, we can prevent or delay some of today's most common and devastating conditions. A lot has changed in the 31 years since Nancy Brinker started Susan G. Komen for the Cure in honor of her sister Susie. Back then, people seldom talked about breast cancer. Women didn't know how to protect themselves. And because they didn't know to get regular mammograms or to do breast self-exams, breast cancer was often diagnosed too late. But Nancy, thanks to your 3 decades of tireless work, millions of volunteers now offer their time and energy to raise awareness of breast cancer and to raise funds to find a cure. Today, all Americans know what the Pink Ribbon stands for, and American women talk openly about breast cancer, and survivors, like my mother, Jenna Welch, share stories of triumph. As the invitation chair for Nancy's early fundraising luncheons in Dallas 22 years ago, I would never have imagined that Susan G. Komen for the Cure would broaden its reach to all corners of the world. The World Health Organization estimates that more than 1.6 million people worldwide are diagnosed with breast cancer each year. Many live in countries where the disease carries stigma and shame. By sharing the lessons that we've learned, Americans can empower more women to detect breast cancer early, which today is the closest thing we have to a cure. Work that started in Nancy's living room in Dallas is now saving the lives of women in Budapest, Dubai, Guadalajara, Sao Paulo, Rome, and other cities around the world. In 2007, when George was president, I traveled to the Middle East to announce a Middle East partnership for breast cancer. The Middle East has high mortality rates from breast cancer. Women diagnosed often face social ostracism. Their husbands might abandon them. Their sons might turn their backs, and their daughters can be considered unmarriageable. But the region also has some brave advocates for women and for women's health, and one of them is in the room today with us, Dr. Samia Alamoudi. Dr. Samia is living proof of a survivor's power to speak out and save lives. She's one of the first Saudi women to speak publicly about her experience with breast cancer. She uses her weekly column to write about breast cancer, and she shares her stories in newspapers and television interviews. Dr. Samia, please stand up so we can recognize you. Dr. Samia has just been appointed as a member of the Union for International Cancer Control. Congratulations, Dr. Samia. Dr. Samia's example and that of many other women I've met in my travels illustrate an encouraging and powerful phenomenon. Women are increasingly agents of change in our world, and acting as advocates for health and education to advance opportunities for themselves and for their families. By giving women the tools that they need to succeed, such as access to education and health care, they not only improve the well-being of their own families, but they improve the stability of their countries. After her sister Susie died, Nancy Brinker lay in bed at night wondering how she could make a difference. How could one young woman change the way we confronted a deadly disease? 25 years later and halfway around the world, a woman I met in Saudi Arabia offered the answer. "I'm only one woman," she said, "but together we're a force to be reckoned with." By educating and empowering women to take charge of their own health, we're all a force to be reckoned with. Everyone here, individuals and organizations, have learned from Nancy Brinker and Susan G. Komen for the cure. Nancy, you've been an example to us all, showing us the way to address a disease and how to educate and raise awareness. 10 years ago, HIV/AIDS raged out of control. Worldwide, more than 22 million men, women, and children had died from AIDS, and 15,000 people were infected with HIV every day. In 2002, experts estimated that the AIDS pandemic could double in the next 5 years to 80 million people infected with the virus. Health professionals and leaders around the world knew that dramatic action was necessary to address this crisis. In June 2002, my husband, President Bush, spoke to a crowd gathered in the Rose Garden. He said, "The global devastation of HIV/AIDS staggers the imagination and shocks the conscience." That day, he announced a $500 million initiative to combat AIDS by treating HIV-infected women with antiretroviral drugs to stop transmission of the virus between mothers and babies. 6 months later, in his 2003 State of the Union address, President Bush announced the President's Emergency Plan for AIDS Relief, the largest international health initiative ever directed at a single disease. PEPFAR committed $15 billion over 5 years to prevent new infections, to treat those already infected with AIDS, and to care for children orphaned by the loss of a parent to AIDS. Later that year, George and I traveled to Africa, where we saw firsthand the devastating toll of AIDS. In a pediatric clinic in Botswana, my daughter Barbara and I met a mother who had brought her little girl in for treatment. She had dressed her daughter like an angel in a lovely lavender and white dress to meet the American president. This precious little child lay on an examining table, so frail and sick. Her mother's last hope was to make her beautiful. Today, with access to antiretrovirals, that little girl would have had another chance to life. In fact, last summer we returned to Botswana and we saw that same pediatric clinic, and it now has so few patients that they're looking for another use for this facility. Thanks to PEPFAR and to our partners around the world, millions of lives have been saved. Mark Diebold, who's our new director now of the Global Fund for AIDS, TB, and Malaria, was our director of PEPFAR. And I don't know if Mark is here, but if he is, I hope he'll stand. I know he's coming this afternoon. The success of Komen for the Cure and of PEPFAR has given us proven strategies to confront other health challenges. At the Bush Institute's Global Health Summit in Washington, D.C., in September 2011, President Bush announced the Institute's new partnership, Pink Ribbon, Red Ribbon. The Bush Institute is partnering with Komen for the Cure, the U.S. State Department through PEPFAR, and UNAIDS to screen and treat for breast and cervical cancer among women in the developing world. Several private sector partners are also supporting this initiative. Merck, Becton Dickinson, Bristol Myers Squibb, the Caris Foundation, GlaxoSmithKline, IBM, QIAGEN, Airborne Lifeline, and the National Breast Cancer Foundation. Dr. Grossbeck Parham is one of our partners on the ground in Zambia. Thank you so much, Grossbeck. The Pink Ribbon, Red Ribbon initiative is building on the PEPFAR platform to screen and treat women for breast and cervical cancer. Cervical cancer is the leading cause of cancer deaths in sub-Saharan Africa, and it's a preventable and treatable disease. It's up to 5 times more common in women living with HIV. Pink Ribbon, Red Ribbon combines the skills and the know-how of the public, private, and nonprofit sectors to reduce deaths from women's cancers and to save lives. Pink Ribbon, Red Ribbon not only offers screening options, but it's also changing how health care is provided, literally from the ground up. Local healthcare workers are being trained to conduct screenings and to treat patients. Vital vaccines like the HPV vaccine are being donated to our Pink Ribbon, Red Ribbon partners and are by our partners and are being administered across the region. New healthcare facilities are being built and existing ones are being refurbished. George and I launched Pink Ribbon, Red Ribbon in Zambia in December 2011. When we returned to Zambia last July, President Bush and I were thrilled to see the progress. Pink Ribbon, Red Ribbon has expanded beyond the capital city, Lusaka, and across the country. Multiple clinics are screening, diagnosing, and treating women for cervical cancer. We traveled to the Zambian provincial city of Kabwe, home to some 200,000 people, where we refurbished the Ngungu Clinic. We spent 4 days re-roofing, painting, and installing new medical equipment. While our small group of volunteers worked to refresh the clinic, nurses were trained to screen and treat cervical cancer. When we finished the renovation, we stood with the clinic's doctors and nurses, including Dr. Kennedy Lashempe, who was on one of our panels earlier this morning, to cut the ribbon and to officially open the doors of the clinic. And in the clinic's small yard, more than 30 women watched, and all of these women were screened at the clinic that day. By the end of 2012, more than 1,500 women had been screened at Ngungu Clinic for cervical cancer lesions. 121 were treated on-site with cryotherapy for precancerous lesions, and 348 were referred to the District General Hospital for more advanced diagnosis. Already, more than 22,000 women across Zambia have been screened. Nearly 40% of those women are HIV positive, and nearly 1/3 of all women screened tested positive for precancerous or cancerous cervical cells. And of those who tested positive, more than 85% could be treated immediately with cryotherapy. But these are so much more than numbers. They're lives. Next to the Ngungu Clinic is a maternity ward. As we were painting on that July day, a mother was giving birth to a brand new baby daughter. Someone told me that the new mom had named her baby Laura. When our paint... I was going to try not to weep. When our painting was finished, I hurried next door to meet the mom and the baby. I'd like to imagine that this little Laura's future is one full of hope and free from disease, because that's what Pink Ribbon, Red Ribbon stands for. And just so you know, the city of Kabwe also has a baby George. On the morning that George and I cut the ribbon for the refurbished clinic, another mother gave birth to a baby boy and named him George. I'm not going to try to predict the future for this little Laura and George, except to say that it will be brighter because of the efforts of so many of you in this room. Thanks so much to everyone here, and especially to my friend Nancy Brinker for all you do to advance the good health of women everywhere. I'm proud to partner with you. Thank you all very much.